Okay, I can see now we are live. So sorry everyone for the delay in starting of our class. We had some technical hitch. We were not able to connect the Kenneth platform with the YouTube, but we are now live, and so we can start our class. Sorry for keeping you waiting for 30 minutes. I know that for the other lectures, for the last 2 weeks, we have done quite a number of topics. We were taken through different modes of HIV transmission by Dr. Josi, and we were also taken through factors, social cultural factors that enhance HIV transmission by Dr. Kithaiga. And so for today, we are going to look at HIV and drug use. And this topic is actually a build-up of what we have covered in the other classes. It kind of complements what already we have been taught. And so now from this topic, for the other topics that we are going to cover, they are going to form your second cut, which will be done on week 11, I believe on the 17th of November. That's when you'll be able to sit for your second cut. And it will be, and the topics that will be covered from mine and the others that are likely to come, then that will form your second cut. And we are also thinking of giving a makeup cut for those who missed the first cut. And this one, again, it will be done after the second cut. So if you know you missed your first cut, please purpose to do your second cut, which will be a makeup cut given to those who have missed their first cut, and that will be given on the after the second cut. So what are the learning objectives for our topic today? Is that we should be able to explain the relationship between HIV and drug use at the end of this lecture. So I will start by definitions, giving a few definitions. What is a drug? And then we'll be able to look at what is drug abuse, some of the common symptoms of drug abuse. We'll also look at examples of some of the drugs and substances that are commonly abused. And again, we will now try to link drug and alcohol use with HIV transmission. How does it enhance HIV transmission, or how does it affect the progression of HIV among people who are infected? So how do we define a drug? A drug is any substance apart from food that when taken, it causes physiological or psychological changes in the body. A drug, any substance that when taken will affect the physiology, that's the functioning of your body, but it can also have psychoactive effects in your brain, affect how you think, how you perceive things, and so on. For example, it may affect one or more functions of the body. And here we can give example of, let's say, when someone feels pain, and you take analgesic drugs which are used to manage pain, like aspirin. Then the aspirin, in that case, it makes the pain to disappear or to reduce. And that means that's basically the drug is affecting the functioning of your body, your physiology. And to illustrate on the issue of psychological changes, think of if someone, when they take marijuana or bang, then that is likely to affect on how they see things, how they hear things, and so on. And again, that means drugs are able to affect, to have physiological effects in your body. And so the term drug, it basically includes all the substances that are useful to the body and also those that cause harm to the body. So it's a kind of combination of both useful drugs and, of course, those that cause harm to the body. And please also note that we have both legal drugs. Legal drugs here, they may include those that are prescribed by doctors in the hospitals, all those that we buy from pharmacies. And illegal here could include drugs that are usually not allowed by governments, like marijuana, for example, cocaine, and so on. Those are illegal drugs. So just to note that you can categorize them into legal versus illegal drugs. But the term basically includes those drugs that are both useful as well as those that cause harm to the body. I'll pause there and ask a question. What is drug or substance abuse? What is drug or substance abuse? Legal versus illegal drugs. But the term basically. What is drug and substance abuse? At what point do we say people are abusing drugs or substance? And for the interest of time, let me just go straight and give you the definition of drug abuse or substance abuse. And this term generally refers to the use of drugs or substances that harm or threaten the physical, mental, social, and economic well-being of the user, and of course his or her family and society at large. So any use of drugs or substances that's likely to affect the physiology, the mental, economic well-being of the user, their family and society at large, basically that refers to drug abuse or substance abuse. And here we mainly talk of narcotics, abuse of narcotics, which are drugs that affect the mood and the behavior of the individual. And again, they are usually consumed, and usually they don't have any medical importance to the people who use them. Most of these narcotics are actually sold illegally. Things like cocaine and so on. It's a class of drugs that usually cause a lot of harm. They affect the mental, the social, economic, and also the physiological functioning of the user and so on. So when you hear drug abuse, what actually comes into the mind is the use of these narcotics, which are illegal drugs. So let me say that drug and substance use is one of the major challenges that is facing Kenya, and not just in Kenya, but also other parts of the world. And it has major implications on the political, on economic sector, and also on the social stability of a given country. And we all know that, for example, in Kenya, we have some parts, like in the coastal area, where drug and substance abuse is very rampant. And this is actually one of the factors that is associated with things like increased crime in those areas, violence, and of course, the users may also become long-term dependent on these substances or these drugs, which again is another serious issue that can be addressed through rehabilitation and so on. And even for those who go through rehab, some of them are also likely to relapse to this behavior of using drugs. So just know that there's a high linkage between drug and substance abuse and crime and violence. And so that's the main reason why I said a drug is likely to affect the social stability of a given country. And even the users, their economic status is also one of the sector which is affected by the use of drugs. There are also situations where individuals overuse, so there's overdose, and that is one of the factors which also claims the lives of many of the users. That in itself may also lead to loss of human resources, which can affect economic growth. So there's even though I'm not going to talk about the impact of drug and substance abuse in more details, just know that it is a menace which affects so many economic sectors, and I've just listed some of them. And lastly on this is that there's also a very strong linkage between drug abuse and HIV infections. In fact, when Dr. Nyabuga was teaching us, he mentioned that drug and substance users is one of the group which has higher chances of getting infected with HIV. I think that was well captured in his lecture. But again, we also look at this in some more details towards the end of this lecture. So there's a very high linkage between drug and substance abuse and HIV infections, and we'll see. We'll try to look at that linkage in some more details and give some factors that are associated with HIV transmission among drug users and so on. Let me ask you, what are some of the common drugs and the substances that are abused in Kenya? What are some of the common drugs and substances which are abused in Kenya that perhaps you are familiar with? You can type your answers in the public chat. Some of the common drugs that you think are common in Kenya, or I can see from the public chat, some of you are mentioning miraa, some of you are saying abang, alcohol. It's also cocaine. It's heroin. And someone is mentioning what the Spiriton. Yeah, some of these drugs that we abuse are actually drugs that are used for management of various conditions. Like Spiriton may be given for quite a number of elements. Someone is giving Kanketa. I don't know what is that. Cocaine, cat, miraa, and so on. Tobacco, and so on. So all those answers are correct. So we have, so there are quite a number of common drugs and substances that are abused in Kenya. And these drugs include alcohol, very common. There's also marijuana, or what we call weed. We also have a bang, which some of you have also mentioned, tobacco, cigarettes, shisha, commonly used in clubs and so on, and cocaine is also one of the, what I referred as narcotics, one of the drugs which are commonly abused in the coastal area. And we also have heroin, the cat, this is basically miraa. And please also note that even drugs which are given in the hospitals, like morphine and tramadol, which is mainly used to manage pain, they may also be abused because like morphine and the tramadol drugs that are analgesics, so they are used to manage pain, and sometimes a patient may use them beyond the time which they were supposed to use the drug, because they usually cause hallucinations. They have some psychoactive effects. People feel high when they take them, and so because of that, some people may keep on using them even beyond the time when they are supposed to use them. And one thing is that drugs, like someone mentioned about Piriton, which can be used, which can be given for management of other conditions. Usually, these drugs, because we know that the primary reason why they are used is to manage pain. So if any drug that you buy from the pharmacy is used for other purpose apart from the primary reason where that drug is supposed to be used, then we refer to that as abuse. Because here, like for example, people who use morphine and tramadol, they don't use it to manage pain, but they use it to feel high and so on. So again, we also have that component of drugs. Yes, they are legal drugs, but they may also be abused by people. And I remember there was a documentary on the use of codeine syrup. It's mainly found in syrups, which are used to manage a cold and a cough. And again, this is one of the drugs that some young people, youth, may also abuse them because they feel high, they feel like they've taken alcohol when they use these drugs, these syrups containing this molecule called contain. And one of the challenges that we have with some of these drugs from the pharmacies is that you can buy them over the counter. So we refer to them as OTC drugs. You can just walk in any pharmacy and you buy them. So that makes them more available, and people, perhaps that's one of the reasons why people tend to overuse them. But the common one are actually the first four: alcohol, marijuana, bang, and tobacco. These are some of the commonly used drugs and substances in most parts of our country. Having mentioned that, there was a study which was done in 2020 at the University of Nairobi. And this study, I think there's a delay in terms of connection from my side to the YouTube, but you'll be able to see the slide. So this study was done in 2020 by someone called Musyoka et al. And the work was published in a very good journal, which is PLOS. And they were looking at drug and substance abuse among first-year students at the University of Nairobi in 2020. And there are very interesting findings from this study. For example, they found that alcohol was the most commonly used substance by the first years at 22%. And this was followed by cannabis, this is bang, which was at 8%, and tobacco was 70%. And in addition to this, they also found that most of the first years were also using multiple substances. And this was at 13% of all the participants in that study, which was about more than 500, about 500 participants in this study. So 13% were among individuals, were first years who were using multiple substances. And the various combinations in this case were cannabis, tobacco, and alcohol. So they were either using any of these combinations. And most importantly is that they also found that students who are living in private hostels, were 4 times more likely to be current substance users compared to those who are living on campus. So living within the university had less odds of taking some of these substances. That's when you compare to individuals who are living in their private hostels outside the university. So again, meaning that here it's like living in private hospitals gives some people more freedom to use these drugs. So it's an interesting finding, and I think this study can also be extrapolated in other universities. I think it kind of paints a picture of what is happening in other universities, because even if we were to conduct a study at the University of Nairobi, I'm sure, or most likely, we could also have some similar findings in our university and other universities. So again, this emphasizes that alcohol, cannabis, and tobacco are actually some of the main substances or drugs that are abused among most of the youth in our country. Please, if you want some more details about this study, apart from some of these key findings that I have highlighted, you can just copy paste the name of this article and you'll be able to download it from any Google search engine. Alternatively, you may also copy this link and paste in any search engine, and you'll be able to learn more about this study which was done at the University of Nairobi. Sometimes it is good also to draw comparison with other places. What are the common routes of illegal drug administration? What are some of the common routes of illegal drug administration? How do people take these drugs? Through which route? What are some of the common routes of illegal drug and administration that you are familiar with? Just paste your answer on the public chat before we look at them in some more details. What are some of the common routes of illegal drug administration? How do people take illegal drugs? Night Kapchonge, you are saying through injection. That's correct. And Ian Mwiti, you also mentioned the same, through injection. It's also someone else who is Welbeck Peters. You mentioned oral. You also mentioned injection, Mutuku injection, Sam Gishuki injection, and so on. Alice Mudeu, you mentioned through smoking. Stephen Sausi, you also mentioned smoking. Kenneth Kavanti, through smelling, or perhaps did you mean inhaling? Abraham Kianyua, inhaling. The key Mruru, chewing, and so on and so on. And Victor, you also mentioned orally, together with Mary Nganga, and so on. So Joseph Itondo, sniffing, Ghost, swallowing, sniffing, and so on. Emmanuel Mutisian, drinking, and so on. So basically, all those answers that you are given are some of the common routes that individuals used to take these drugs. And Shikuku, you mentioned inserted in the rectum. Yes, but not a common route. Not a common route. In fact, what most of you have mentioned in the public chat are the common routes. So we have the oral route. That means they are taken through the mouth. This could include swallowing. And we also have alcohol in this case. And I think cut here could be misplaced because this is mainly through chewing. And we also have injection. Some of you have mentioned in the injection into the veins. This is what we call intravenous route. And a good example of a drug which is taken through this route is heroin. Not sure about injection into muscles, but I just mentioned it because drugs that are taken through intramuscular or through the muscles usually take time before they reach your blood circulation system. It's a method which ensures that there is a slow release of that drug. So not very sure of this, but injection through the veins is a common route. And here we have an example of heroin. And again, some of you also mentioned inhalation and sniffing. Good examples. In this case, we have heroin and tobacco. And snorting, none of you have mentioned about snorting, or perhaps have not seen it. Snorting is where you close one nose and then you try to force the drug into your nose. Good example here is cocaine and heroin. Drugs may also be applied directly on the skin. We refer to this as topical administration of drugs, and they may also be injected into the skin. And of course, we also have drugs or substances that are taken through smoking. And here we have shisha, we have tobacco, heroin, and also bang. So you notice that there are some of the drugs which can be taken through multiple routes. Look, for example, the heroin can be taken through injection. It may also be taken through sniffing. May also be taken through snorting, and also individuals may also smoke them. So there are that situation where you may have drugs be taken through multiple routes. And some of the reason as to why individuals take these drugs, there are quite a number of factors or reasons as to why people take drugs. One of them could be to control emotions. So individual may take them to control their emotions, like alcohol. Some individuals may also take them to for relaxation or for recreational use, very common among youth. So individuals, when they are free and they are hiking, so that would be a very good chance for some of these individuals to take some of these substances. Tension relief, some individuals take them because of boredom, and others may also take them to increase sexual performance. And some of them may also be taken to induce sleep. Like someone mentioned about Piriton. Piriton is a drug that is used to manage a cold and so on. But when taken to induce sleep, then we refer to that as a drug abuse, because it is not used for the primary function, for the management of a condition like colds and so on. But here it may be taken to induce sleep in some individuals. So the list may not be that exhaustive, but it leads, but at least it points out some of the reasons as to why individuals abuse drugs. What is the motivation? What makes individuals to use some of these drugs? But I think some of them, like recreational, usually may play a very major role. And on the issue of increase of sexual performance, very common among individuals who take bang. So they claim that bang actually increases sexual performance, and also cocaine may also be associated with this factor, in addition to other risk sexual behaviors like anal sex and so on. General symptoms of drug abuse. What are some of the symptoms that individuals who use drugs manifest? What do they manifest? What are you likely to find among individuals who use drugs? And before we look at that, let me see if there are some questions that I can answer from the public chat. There being reasons to use, it's good to use them. There being reasons to use drugs, is it good for us to use them, specifically illegal drugs? No, you should not use illegal drugs. You should not use illegal drugs. And this is the reason why we are covering this topic, just to highlight some of these things, so that you don't end up being part of the statistics of people who use these drugs. Do not use these illegal drugs. They may affect your physical, like I said, they may affect your social life, and most importantly, they may also affect your academic performance in the university, because some of these individuals usually withdraw. They don't perform very well in the class. We will look at some of these symptoms which these individuals manifest. What is snorting? I said snorting is like it's a forcing drug through the nose, and this basically involves you close one nose and then you try to sniff forcefully the drug into your nose. And I mentioned that snorting is common among cocaine users. What is the difference between drug abuse and misuse? Drug abuse and misuse, again, I think the two terms may not be that different in terms of what they mean, because basically drug misuse would refer to using drugs for other purposes apart from what the drug is supposed to be used. And that perhaps would apply to these drugs which we get from the pharmacies, like the morphine and the tramadol, which are mainly used for management of pain, but individuals may use them for other purposes, like to feel high, for other purposes apart from what the drug is supposed to be used. What is the difference between marijuana and bang? Marijuana, here we mainly talk of this mainly the leaves of this plant, which we refer to as cannabis, and mainly the leaves of that plant, and of course it may also include the seeds. And the mode of the mode in which marijuana is taken is mainly through smoking. A bang in this case, it's a kind of a combination of several parts of that plant. It could include the seeds, the leaves, and the buds or part of the flowers of that plant. And another major difference between marijuana and bang is that bang is edible. In most cases, it is edible, and it's a concoction of several parts of the cannabis plant, and it is edible. Some people use it for making things. I've seen people, but let me not mention that you might be tempted to try. But it is mainly bang is mainly edible, concoction which is made edible, unlike marijuana which is mainly smoked. And so on. So let's continue. I'll be able to look at the questions at some point towards the end. Is bang a medicine? Bang is not a medicine, but we all know that the plant, the cannabis sativa, could have some other active ingredients which can be used for management of several conditions, but bang is not medicine. It is not. Is P2 drug abused? Let me answer that towards the end. So the main symptoms of drug abuse include isolation. People who use these drugs may isolate from families and the friends who don't use them, and they may also spend time with new friends or friends who get high or drink. So they spend time with people who use these drugs. They usually have financial issues, challenges, problems. So they never have money, and they always ask for money, even to buy small items. And this is because most of this, the money that they have, a huge percentage of that money is spent in buying these drugs and substances. So they end up being broke. And so financial problems could be one of the indicators of drug abuse, especially people who are working. And showing up late to work in school and not showing up at all is also one of the indicator symptoms of drug abuse. Those who are not employed, they do very little to find a job. So you find them sleeping during the day, and they don't usually work hard to be able to get employment. And in addition to this, these individuals, they also pay less attention to basic hygiene. So you find them that they're very dirty. They don't pay much attention to basic hygiene practices, and they also exhibit changes in mood. So they're very moody. They may not have appetite, and they may also have sleeping habits, always sleeping and so on. And again, they are also lying about using the drugs or drinking. So they live in a life of denial, lying about using these substances or these drugs. Those who are in high school or in places where, mainly in high school, they may sneak away to get high and drug. So again, that could also, it is also one indicator that this individual may be using drugs. They are always having legal problems because of their engagement in risky behaviors, and some of them may also be unable to stop. So you find that long-term dependence on the drugs, they become chronic users of these drugs and substances, and again, this has a significant effect on their life, because most of them need to be taken through rehabilitation, and so that they may be able to leave those practices. And again, one of the challenges with this long-term dependence is that we have something which we call relapsing. So a person may undergo rehabilitation, but they may also relapse. So you find them going back to the old practices of using drugs. Very common among these people who we refer to them as chronic users of drugs and substances. And then lastly on this is that they are extremely private about their possessions, very private. They don't want someone to touch their bags, rooms, their cars, because some of these drugs and substances may be hidden in those places. So basically, these are some of the indicators of or symptoms of drug and substance abuse among these people. Let's look at something else. And here, I want us now to look at linkage between alcohol and drug abuse and HIV transmission. The linkage between alcohol, drug abuse, and HIV transmission. And like I said in my initial slides, is that there's a high linkage between drug and alcohol use and HIV transmission. And Dr. Nyabuga taught us that drug and alcohol users are among the most susceptible groups to HIV infection and alcohol. So you find that HIV progression in terms of moving from HIV infection into AIDS, which is the last stage of HIV infection, usually takes, it is much faster compared to non-drug and users. I mean, it is much faster among drug and alcohol users compared to individuals who do not take drug or alcohols. And again, we are going to look at some of the reasons as to why this is the case. So on the first one, just to do a quick recap, is that we know that the use of drugs and alcohol is mainly associated with other risk factors, which enhances HIV transmission. For example, among drug users and alcohol users, we know that they usually have multiple sexual partners. So these are multiple sexual partners and engagement, having sexual intercourse with multiple partners, which is a risk factor for transmission of HIV. And again, some of these individuals may also be having what we call STIs, sexually transmitted infections, the STIs. We know that some of these STIs may also cause wounds or lesions, what we call lesions, or ulcerations in the private parts and other parts of the body. And when someone engages with multiple sexual partners, then those STIs openings become entry points for the HIV virus. So engagement in multiple sexual partner is actually very common among drug and alcohol users, and that in itself is a risk factor for transmission of HIV. Another key factor which is associated with this is decreased rates of condom use. So most of these individuals like it dry, in quotes, so they may engage in unsafe sexual activities. So there is less use of the condom, and so because alcohol actually reduces sex inhibition, so individuals may not be able to make informed decisions with the right of with the respect to use of condoms. And even in addition to this, you may find that there is inconsistent use of condom among these individuals, and so on. So again, that may also increase chances of HIV transmission. And again, on this, there is also increased risk of transactional sex. So individuals may engage or may trade sex for drugs to be able to purchase drugs and alcohol. And even on top of this, we may also have what you call intergenerational sex. So you find that young girls having sex with old people, and old people may also be infected, maybe because of their time, because of engaging in sexual activities for a long period of time. That, again, is also something that should also be considered in this case. It is also reported that among individuals who use cocaine, they also engage in anal sex. And again, on this, Dr. Nyabuga taught us that men who have sex with men are also more susceptible to HIV infections compared to those who do not engage in these risk sexual activities. So again, that in itself, anal sex, is also another important risk factor which is known to increase chances of HIV transmission. Let me also mention the use of alcohol and HIV and HIV medications. It is noted that HIV use decreases adherence to HIV medication and other medications. So you find that people may skip their drugs, which are supposed to be taken on daily basis. So you find that people may not take their ARVs on daily basis as required, and those short periods of disuse of HIV actually are good opportunities which can increase the replication or the multiplication of the HIV virus, and that in itself can lead to increase in the viral load. Viral load here means basically it refers to the number or the copies of the HIV virus in 1 ml of blood. So you find that those periods of withdrawal of not taking the ARVs actually creates a very conducive environment for the multiplication of the HIV virus, and that will lead to increase in the viral load, the number, the copies of HIV virus in 1 ml of blood. And when I was looking at some of the literature, I also noted that HIV patients who take alcohol also have many opportunistic infections. And in the first lecture, I said these are conditions or infections which normal people are able to fight. And it is thought that these opportunistic infections may also develop during periods of ARVs disuse, when these individuals are not taking their ARVs. We also have another point here which says that both alcohol and methadone is a drug which is used to manage pain, and it is also used in the treatment of drug addiction. There is enough evidence showing that both alcohol and this drug, methadone, may also interact with ARVs drugs. So there is potential drug-drug interactions between methadone, alcohol, and ARVs, and that ultimately can lead to either decrease in the effectiveness of ARVs. So it may also lead to toxicity, and toxicity here means that your liver, which is mainly involved in the metabolism of these ARVs or alcohol detoxification, may also be affected. Its function may be affected, and that in itself means that the individual is likely to progress into HIV because their liver is not functioning optimally, especially in the metabolism of these ARVs to be able to form active ingredients which fight the HIV infection. Please note that when we talk of decrease in the effectiveness of HIV, it means that the individual, it means that the virus in the infected individual will be able to replicate or to multiply much faster because the ARVs is not working as expected. And of course, I'm not sure, but I think in the next lecture, whoever will be teaching, they may also mention something about these ARVs and how they work, what they target, and so on. I don't know whether we have questions. Yes, we are running out of time. We are finishing in a few minutes. So let's continue. Drug and alcohol and drug use is also associated with stigma and discrimination. So there's a lot of stigma and discrimination among individuals who use alcohol and drugs. And because of that, it can lead to denial, self-denial. The individual may also not seek primary health care. They may not seek healthcare services as soon as required. So there's delayed diagnosis of HIV, and there's also reluctance to seek medical care. So you find that because of this, because of denial and delayed diagnosis, this in itself actually allows the HIV to multiply, destroy your soldiers, the CD4 cells, and you progress, and the individual is likely to progress to AIDS status because of this delayed diagnosis. In fact, it is said that delayed diagnosis is actually likely to affect the outcome of any treatment, irrespective of any disease that we're talking about, whether HIV or another condition. Even in the case of cancer, a better outcome, a better treatment outcome is achieved if there is early diagnosis of a disease. And this also applies in the case of HIV. When individuals are put on ARVs as early as possible, when they still have their CD4 numbers at that high level, then they're likely to have a better healthcare outcome compared to individuals who are put on ARVs in the late stages of their HIV infection, when potentially they have progressed from HIV infection at the late stages of AIDS. Signs and the symptoms of alcohol and drug addiction, sometimes they may also overlap. So you find that it may not be possible to distinguish these signs of alcohol addiction and drug addiction with HIV. And again, this point is also connected to what I have said. It further complicates and makes early diagnosis impossible, and of course, management of that condition is also delayed. And then on this point, please also note that drug and alcohol use is also associated with many comorbidities. These are other illnesses which can also delay diagnosis. They may also complicate management and also make accelerate HIV progression and substance abuse. So these 3 points are kind of connected if you look at them keenly. Let's also point out, I think we have like 2 or 3 slides, then we wind up our class, is that alcohol use and other drugs, which we refer to them as opioids. Opioids in this case include cocaine. They have been shown to increase HIV replication, and they may also affect the functioning of lymphocytes. Lymphocytes are white blood cells, and one of the important lymphocytes or white blood cells are what you call the CD4 cells, which I mentioned in the first lecture, are one of the cells that are affected by the HIV virus. So the HIV virus gets into these cells and destroys them. And so individuals who take alcohol and these opioids like cocaine, it means that the functioning of the CD4, which are basically supposed to help in clearing the virus, are usually affected. And that, again, may also lead to increase in the viral load through the multiplication of the virus in the body. And in general, please also note that drug and alcohol use may also affect the overall health of a person, so making them more vulnerable to HIV infection. In fact, there's a very high linkage or correlation between alcohol use and the malnutrition in these individuals. So there are individuals who take alcohol without taking their meals are likely to be malnourished. So it could lead to malnourishment, and and we know that nutrition is one of the factors which affect our immune system functioning, and that means when someone is malnourished, their immune system is not functioning effectively as it is supposed to be. Please let me not overemphasize on this, because next week we'll be taken through the immune system, how HIV affects the immune system, and of course, I think some of these things will be clarified there. But just know that there's a linkage between alcohol and malnutrition, and nutrition is one of the factors which affect the functioning of the immune system. So if someone is malnourished, then they become more vulnerable to HIV infection if they are not infected, because their immune system is not functioning effectively. And there's also we also know that excessive use of alcohol may also cause immune suppression. So your immune system could also be suppressed. And again, it may also affect the functioning of other white blood cells, like the macrophages, which are able to ingest and digest a number of pathogens. It may also affect other cells of the immune system, like the B cells. These are cells which play a very major role in secreting of antibodies, proteins that help in neutralizing the virus. So if someone is taking a lot of alcohol, then their immune system becomes suppressed, because a number of white blood cells that play a very major role in fighting the virus, they are usually affected. Their functions become impaired because of excessive use of alcohol. And here we're talking about macrophages, which I said they ingest a number of pathogens, but they may also play other roles, like activating other cells of the immune system to be able to carry out their functions effectively. There's also, when you look at intravenous drug users, again, this was mentioned by Dr. Nyabuga in his lecture. He also said that individuals who inject drugs, what we call intravenous drug users, are also at a higher risk of contracting HIV infection and other viral infections such as hepatitis C, and this is because of sharing of syringes and needles. So that is the main reason as to why this group is more susceptible to HIV infection. But not just to HIV infection, but they may also be susceptible to other viral infections like hepatitis C. And if someone has both hepatitis C and the HIV, then they may have what we call liver cirrhosis. Their liver is damaged in a situation where someone is having a co-infection of both hepatitis C and also HIV infection. And usually survival of such individuals is decreased, and of course HIV progression among individuals who are having both infection is also noted to be very high. And even individuals who have hepatitis C and they have HIV, again, treatment outcome among those individuals is also very poor, because hepatitis C is thought to be a marker of poor treatment outcome among these individuals. And this is because of the fact that there is a damage to the liver, which plays a very major role in the metabolism of the ARV drugs. So you find that the ARVs may not work effectively when their liver is damaged, because it is the liver which breaks down these ARVs into active ingredients that fight the infection. And so if you have hepatitis C, someone has HIV infection and they are taking alcohol, now the effect of these three conditions usually will be what we call, they'll be magnified, if I may say that, because all these conditions, hepatitis C is affecting the liver, HIV, drugs, ARVs are metabolized in the liver, and alcohol nutrition also takes place in the liver. So the liver plays a of alcohol and so on. And then lastly on this is just some linkages to some of the materials that were used to prepare this lecture. So if you have some free time, please try to download these articles and look at them, and you'll be able to get some more information on the linkage between alcohol use and HIV infection, as well as HIV progression. All these articles are available online. You can copy paste the title of the article in any Google Scholar, in any search engine, but you may also use the link, this one. If you just click on this link, control, then you enter, it will take you to that article where it is, so long as your phone or your laptop is connected to the internet. So let me look at see if there are some questions before we wind up our class. I don't see any question from the public chat. So please answer the first question. Is P2 a form of drug abuse? Of course it is. It's a form of drug abuse because P2, these are emergency pills taken when someone has had unprotected sex, and the frequency of use sometimes becomes a challenge. People may use them more frequently, and that in itself is actually a drug abuse because these are emergency pills and not they're not like they're not supposed to be taken so frequently. Yeah, they're emergency pills. Also, someone is mentioning here, also these drugs causes excessive appetite in the liver. So abstain from these drug users, you utafuliza immediately. Yeah. So there are many symptoms that are associated with the bank, and that could be one of them. But again, like you mentioned here, individuals may run into financial problems if they engage in, if they use some of these drugs. Just to sustain their life, they may also engage in other illegal activities, which can put them into problems. Anything else from the questions? Someone is asking my name. My name is Dr. Ndiwa from Biological Sciences. Yeah, someone. Okay, so I think because there are no other questions, thanks for your positive comments on the YouTube. I'm happy that the lecture was good. So one announcement before we wind our class is that the second cut will be done on 17th of November. It will be a sit-in cut, so please avail yourself. And then secondly is that those who missed their first cut will also be given their makeup cut after the second cut. So we encourage everyone who missed the cut to do their makeup cut. Makeup cut will be only for those who missed their first cut. And if you miss any cut, then that means you may not have your final mark, because the two cuts must be there. You must do the two cuts in the main exam. And of course, if there are other assignments, they also count towards your final grade. So I would like to end the class and ask you to proceed to meet your lecturers in your venues where you usually meet them. Have a good day and bye. Serem, you can end the class. Just end the class, please, because we are through.